friends, and thank you for tuning in to another episode of the Optimal Health Program. Hope you're doing well today. I want to thank all our listeners from all of the different worlds that we're in. And, of course, thanking Frankie and Sabrina for doing a terrific job. Our Rumble fans, our TikTok fans, our Reddit fans, our Amazon fans, Spotify, all of the different groups. And we love to take your calls and your questions and your text messages. Thank you so much for emailing the website so we can have contact with you, answer your questions as well. Working diligently on answering so many of our email questions from the website. As you know, we're going to take your calls here today. I'm going to go over a couple of interesting articles, pepper those through the program. And the phone number here is 888-420-9272, 888-420-9272. And, of course, you can text or email Frankie, and we'll be able to see you up on Rumble and see how we're doing. I forgot to put my iPad mini here so I could see the Rumble people coming in and calling. So we'll have to figure out how to do that at some point.
I'll set that up for you. No problem.
Coolness. Okay. Let's get your pen and pad ready so you can take some notes. 888-420-9272. The Garden City office is 516-794-0404. Website, drcalapai.com. And we're off to the races. Interesting research on vitamin D, and you could get on the computer, as I do every day, and find new interesting research on vitamin D and all the vitamins. I think many years ago in vitamin D literature was saying that it decreased the risk of breast cancer. It became a hot topic. Of course, appropriately so. Facilities all over the world started doing research on vitamin D. And now you'd have to work really hard to keep up with all this research. So in doing this, I pulled a great study about cardiac arrhythmias and vitamin D deficiency. The global prevalence of vitamin D deficiency is more than 20%. I think it's higher than that. Because if my practice and all the patients that I see from every walk of life, every background, and we look at vitamin D levels, and most people are deficient, I think it's well more than 20%. Significant number of studies have correlated vitamin D deficiency with increased risk of arrhythmias, sudden cardiac death, cancer. The list goes on and on. But for this study, they're talking about atrial fibrillation and increased QT interval increased. So QT, there's a pathway and an electrical path that occurs to allow, a heartbeat to occur. And changing that electrical path can wreak havoc. So when there's too much firing and there's too many beats on the atrium, the atrial fibrillation, that's a risk for stroke. It's a risk for cardiac death. Big issues and problems there. So vitamin D plays an important role in the absorption and metabolism of calcium and phosphorus, and it does play a role in stabilization of the cardiac membrane. So the myocytes, the muscles of the heart, ventricular myocytes, are dependent on potassium to help conduction occur and the electrical contraction occur. And when this is altered, you have this twitching effect of the heart, which obviously can be extremely dangerous. Another reason why we want to test all of your vitamins, and of course, including vitamin D. There are studies that talk about vitamin D, and it seems that most of them suggest the D levels, as I've suggested, have to be at least in the 70 or 80 range to create the benefit. The blood test for vitamin D goes between 30 and 100. So I think as people get to those higher areas, higher range, you're doing better and better and better. Studies show that vitamin D decreases the risk of a variety of cancers. So important to check your vitamin D levels, especially throughout the course of the year. Now, a lot of people think that if you get some sun, you're getting vitamin D. And to some extent, that's true, but your levels are not going to be where they need to be just from getting a little bit of sun. I have a lot of patients that travel all over the place, go to Europe, South America, Florida, and they're tan. And sometimes their vitamin D levels don't get past 40 or 50. So we have to keep testing and using nutrient intake to make sure you're staying within that perfect range. Another interesting study talking about micronutrients and heart failure. This talks about a variety of nutrients, including calcium, magnesium, potassium, B6, B12, folate, vitamin D, vitamin C, E. And heart failure patients, of course, over time, these are older patients in the population, their vitamin levels are typically low. If your doctor's not being, a little bit forward or aggressive in testing your vitamins, which you should be, and your nutrient levels drop, then your heart's going to be at risk. Your immune system is going to be at risk, and your risk for cancer is going to be higher. So looking at these nutrients makes a very, very big deal in correcting and protecting your heart function and ability. And for a lot of people that are on the cholesterol meds that wipe out CoQ10, the statins, you're wiping out a nutrient that's really important for the contraction of your heart muscle. Everyone knows someone who's taken a statin and has cramping or pain in their leg muscles and elsewhere, and they have to stop it because they have so much discomfort or pain. The way those medications work is that they're blocking how cholesterol is created in the body, and in that pathway, they're blocking the step right before CoQ10 is created. So it's wiping out all the CoQ10. Some people say, well, I'm taking CoQ10. Well, you can't take as much as your body would normally have, and you're not going to see the results improve without getting away from the thing that's pulling the CoQ10 out. So for all the people on CoQ10, and I talked to them about looking at their ejection fraction, we recommend doing an echocardiogram. Because if their ejection fraction, which is the contraction of their heart, to pump the blood out of the left ventricle to go to all your aorta, go to your subclavian, your head, your entire body, if that contraction becomes weak, and if you compare it to prior tests, then you have to understand you can't use those medications. Yes, we would introduce CoQ10 in larger amounts to your system, but I would use other medications that would help to potentially lower the cholesterol, but not wipe out CoQ10. And again, I'm not big on meds for cholesterol. We usually tell people to do low-carb diet, exercise, correct vitamins, minerals, correct hormones. If your thyroid's low, you may not be able to burn down your cholesterol as well. So there are a lot of natural things to do in that realm. So very important to consider the more natural than just to be on medications. Okay, 888-420-9272. If you'd like to call in, you could do so now. We're taking your questions.
Yeah, we got some YouTubers hopping on real quick.
Awesome.
First one, what could be the reason for having high calcium levels in blood when the PTH is at normal levels?
So calcium will fluctuate depending upon what you're doing. Some people take a lot of calcium as a supplement. That might be a cause. In rare cases, some people take too much vitamin D. And vitamin D can push calcium into the blood. Vitamin D has to be well over 100 on your blood test to do that. And again, I see vitamin D levels every day on all my patients, and we recheck them throughout the year. There are some associations with calcium elevation of blood in certain cancers. So you want to make sure that there's no, potential risk for cancer, that no one in the family has anything like that, because that can also cause hypercalcemia. So I would look at all those things in your blood test. Now, one blood test doesn't mean that you're going to have that level every single day or every single moment. I would recheck the calcium, recheck the D, ionized calcium. I would look at the parathyroid again, look at the entire picture. Because one abnormality at one given point doesn't mean it's going to have to be that way all the time.
All right, another one on YouTube. What's the difference in vitamin K1 and K2? And they say it should be taken with D3 for better absorption? ?
Well, vitamin K is important. K2 is typically the more significant. Utilizing that with vitamin D can help to protect your blood vessels, potentially decrease the cardiovascular risk. Just like vitamin D3 is the most important of the vitamin D, the different components that occur with those two separate types make all the difference in the world. People that were looking at prior levels of vitamin D and we're not looking at the D3, we're not getting a true picture of that protection. So the labs all have the breakdown of the different components of the vitamins, and you want to have the two and you want to have the D3, and those work together as an important, protector for your body. But remember, the D has to be in a good range, has to be at least, I say, 60, 70, 80, 90 on your blood test. I thought that'll give you the best outcome.
All right, and then follow up from the same person. It says calcium, vitamin D, vitamin K, and zinc, and calcium should be taken together? Question mark.
There's nothing that says you have to take these things at the same second every day or together all the time. The human body was not made to absolutely require these things together. However, for most people that take vitamins, we're recommending things breakfast, lunch, and dinner. So yes, you could take each of these things with the same time, just as you might a little bit of vitamin C or your B vitamins. It typically works relatively well to take them breakfast, lunch, and dinner, because you don't want to have to, keep separating these things out throughout the course of the day. It'll drive yourself crazy. So yes, breakfast, lunch, and dinner, you should take your vitamins, and those all together would make sense.
All right, another one, YouTube, just popping off today.
Amazing.
So, hi, doctor. I'm 29 and recently stopped taking my birth control. My skin is going crazy, and I feel super bloated.
I got to turn my phone
beautiful.
off. Can't go wrong with Elvis.
I'm never mad.
I forgot to turn my phone off.
But
yes.
29, recently stopped taking birth control. My skin is going crazy, and I feel super bloated. Any advice?
Well, sometimes when you're taking a hormone and you're trying to shut your body's own hormone production down to control that as a birth control, your body goes through different changes. So we'd like to look to see what your hormone levels are. Of course, estrogen, progesterone, FSH, LH. Changes in the skin sometimes correlate with allergies and allergies to foods. And there's some weird occurrence that happens with hormone fluctuations. Some people, when they lose their hormones as they get older, the allergy mechanism seems to increase or comes out of nowhere. Some women who get pregnant and have a child, their allergy picture starts. Didn't have it before, and vice versa. Some people that have horrible allergies that go through the hormone fluctuations, or to have a child when your hormone levels are typically higher, the allergy issues will go away. So it's hard to say. But I think you want to look at all your vitamins, all your minerals, all your hormones, because at the same time that your estrogen and progesterone are being affected, you might also be affecting your DHEA, your testosterone. And again, you want to look at the allergy mechanism, look at your immune response. So you want to look at the entire picture and see what correlates with that.
All right, we got a TikToker. Hey, Doc. Every time I sit down for too long, my legs go numb. But if I stand for too long, my back hurts. Is my body just protesting adulthood, or am I officially falling apart?
Well, adulthood is an important thing. Protesting it's possible. You never know. But typically, when people stand for too long, depending upon how the vertebrae are positioned in your low back, that can cause discomfort in your low back, which could also translate down to your calves and your feet. Some people say they stand too long, their calves are killing them, their knees, their back. So you obviously want to be able to stretch out and sort of change position. For some people that sit down, depending upon the position, you may be putting pressure on the nerve roots in your back, and that could also give you some of that numbness. So it's probably a structural mechanism. For patients that have these issues, sometimes as we have them do the exercises that strengthen their core and their gut, their back becomes more stable. Doing some back exercises, doing some massage may help. Some people will do some circulatory training on and have them do some exercise to really get the blood flowing. We'll see changes in some of this. But again, we've got to figure out why that's occurring. It's probably a musculoskeletal issue. We have nerve conduction testing we do for many patients to see whether or not the nerves from the back going down the legs are being affected and where there's a little bit of a hitch or where there's pressure. So, and then again, an MRI of your low back would be nice to see if there are disc issues there. So it depends upon what we find is the underlying cause. And I know I say that all the time, but it's really true.
All right. Off to Rumble. What's up, Rumble? What's the best way to strengthen the immune system naturally? Best
way is to look at the nutrients that are needed for your immune response. And there are a variety of them. There are all the B vitamins, magnesium, potassium, calcium. As a matter of fact, I picked up an article off of the computer this morning. Vitamin A, vitamin C, of course, because it helps to quadruple your killer cells. Vitamin D, B12, zinc, selenium, B6. The list is very long. So within the first test blood work we do with patients, we're looking at all the vitamins, and then that's just an automatic where we say, this is low, that's low, let's correct it. That enhances your response. You can add on exercise because exercise will flood vitamins, minerals, and hormones to all your tissues and get them directly into your system, so you're delivering them everywhere. And you do see an upregulation of immune response with exercise. It just enhances your ability to get your cells out and about all over the place. So yeah, a blood test will tell us what you're low in, make the recommendation, then retest to prove that your levels are in great range. But there are a lot of good articles about that.
All right, we got a funny one from YouTube. Hey, doctor, every time I eat something spicy, my nose starts running like crazy. My friends laugh at me, but is this a real medical thing? Do I have some kind of spice allergy, or am I just...
It is a real thing. I know a lot of people that feel that happens to. And certain people, when they eat temperature hot soup, their nose starts to run. So there's probably a correlation between either the heat or the spiciness of the food and your body responding by making extra fluid. To some extent, your body wants to protect you from something that's too spicy or from something that's too hot. But a lot of people have that. I don't think there's anything medically wrong with that. Except, of course, you got to eat your soup or have your spicy food with a napkin close by.
We got another question on restless leg syndrome, and they just want to know what it's from and what can cause it, and how could I stop it without medication?
Yeah, it's usually the rapid firing of a nerve to make the muscle continue to move. For some people, it may correlate with anxiety or nervousness because that's sort of a way to channel out some of the energy. For other people, it could be a neurologic issue, so that's why we do nerve conduction tests. Some people have odd nerve reactivity because their nutrients are low, B vitamins. So we have to look at all of those causes to see what it's coming from. Heavy metal exposure could do that as well. Okay, let's see here. Another good article while we're getting some more calls and messages up. Daily omega-3 supplements and regular exercise can help to slow aging. This is a great study put in Medical News Today, and it talks about the importance of decreasing the inflammatory cascade throughout the body and what the omega-3s do. They also decrease some of the excess clotting of your blood. So, and as we talk about putting together the important nutrients, of course, the omegas are part of that. And looking at having each of the nutrients on board can make a very big difference. There are other nutrients and other medications that we use that have anti-aging potential. NAD is one of them. We spoke about that before. That helps to repair your cells, repair DNA, repair your organs. Methylene blue, which has been around since the 1800s, it was originally a dye. They're using now. It helps to inhibit infection. Also helps to enhance mitochondrial function. So there are a lot of good things that have been in the works and even in research for a very long time. So putting things together in a plan or a program or protocol make a great deal of sense.
Got a couple more for you. Lost it. Okay, what are the most underrated superfoods for daily nutrition?
It's a good question. So any superfood has to be an organic component that brings lots of vitamins and minerals. The term superfood is sort of a term that it attracts attention, but there are great nutrient delivery from vegetables and some fruits. The antioxidants in some of the fruits and some in grapes may be beneficial, but again, you have a lot of sugar there. The proanthocyanidins are the benefit, but you don't want too much sugar on board. Berries are also good. Blueberry, blackberry. Comments about squash because you have a lot of minerals in squash, magnesium, potassium. So any food that's a good food is going to be a food that has a lot of nutrients, vitamins, and minerals in it. You can't just take the food and say, wow, I've got superfoods on board and I'm going to be fine. There are mushroom extracts that are really good for your body, and I take a mushroom extract, 10 mushroom extract every day in the morning. I'll take some when I get home as well, and it's got all of the great mushrooms in there which enhance immune response. So there are both foods and then combinations of things that come from food that are the things that give you your best immune benefit, that give you some of your anti-aging benefit. But, there's a list of things. Every now and then I'll see something online and it says, oh, these superfoods will do this or do that. Lutein is very good for your eyes, but taking lutein is not going to make your vision perfect like Superman or, change your world. But you want to have these things on board because they do protect against free radicals because of the antioxidant effect. So although the word superfood is a catchy word, you still have and want to look for the best nutrients in the best foods, fruits and vegetables.
All right, got a good one from YouTube that I could relate to. When people search things on WebMD, when they just have like a little thing that they think is a problem, and it just comes back as like, oh, you have a rare disease. You have 3 weeks to live. You know what I mean? So they want to know how to navigate the web.
The best way to navigate the web is to not look at it. Honestly, because every day I see people that say, I looked this up on the web, and, I don't roll my eyes, but I sort of think, okay, let's hear the disinformation that they've been exposed to, because there are people on the web just commenting without any medical basis or knowledge. So part of the problem becomes, yes, if you have a headache, more likely than not, it could be muscle tension. It could be from a reaction to a food. It could be low magnesium, potassium. And yeah, it could be a brain tumor. But the likelihood that it's a brain tumor is very, 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 very low. So that's why I tell people, write your questions down, call the office. If we have a chance to call you back, or if you want to do a telehealth visit, whatever you like, we'll answer your questions, but don't go to the internet for information because they know nothing about you. They don't know your age. They don't know your weight. They don't know what your blood test shows. So to look at some information that someone put out there, and remember, a lot of information that's put out there on the internet may be tabloid-ish. It's meant to scare you and meant to make you think, oh my gosh. You should be able to just write your questions down and either ask your doctor or speak to your doctor. And certainly I do this for patients all the time. So everything has to be taken into the right context.
My wife's definitely laughing at this broadcast. I may have had a couple, cancer scares for no reason at all. Okay, we got another one from YouTube. How does chronic inflammation contribute to disease, and how can we control it? Good one.
So chronic inflammation, although it's a general word, it describes how cells are damaged by a process. So let's say, for sake of discussion, you have heavy metals on board, and those heavy metals might be coming from the fillings in your teeth that are 50% mercury. That will leach into your tooth, into your blood, and can get inches away to your thyroid. And those metals damage your thyroid because they're hitting where receptors would normally attract and attach magnesium, potassium, and calcium. They're the same charge, 2+, sometimes 3+ charge. So if they're letting the metals get there and the minerals can't get there, the tissue can't work well. And then tissue starts to be damaged. If we talk about a more common and a ubiquitous everywhere scenario, free radicals are things that damage tissue by stealing an electron from the outer orbit of that cell. And that's oxidation. Antioxidant vitamins stop that. But when you steal that electron from the cell, you're causing damage, and that cell, repeatedly exposed to free radicals, will break down. Some of those cells will become cancer cells because of that. Free radicals from cigarette smoking causes cancer. We know that. Free radicals from excess sunlight can increase your risk for skin issues or skin cancer. So the list goes on and on. So inflammation has to be broken down to a very specific comment or definition when we're talking about different disorders. There's research I just looked at yesterday about heavy metals causing autoimmune disease, and autoimmune inflammation is painful. Just look at rheumatoid or lupus or any of these things. So there are many things that can come along and create an inflammatory cascade. For some people that eat a food they're allergic to, there's a cascade that could occur, and some people have joint aches and pains because the antibodies binding to those foods can irritate your joints. That's an inflammatory, process. So we have to define exactly what we're talking about and change that picture. There are lots of conversations about what should I eat and I shouldn't eat. Anti-inflammatory diets. So it's not as though you can just change the foods and really dramatically change everything going on in your body. I think that if you keep away foods that have preservatives, chemicals in them, it's a great thing because they're damaging for your body. I think if you eat organically, it's a great thing. I think some people that eat organically can eat foods they're allergic to, not realize it, and that can still cause inflammation. So I've had discussions with patients when they've done the great diet mechanism and done a good job at that, still have to test for food allergy because a delayed allergy can cause symptoms and cause that inflammation, but they weren't aware of it. So it's got to be defined in a really good conversation. And on the basis of testing, we could determine that, yes, now you are on a great anti-inflammatory diet. And if we use antioxidant nutrients, that will further help the picture. But when people do diets on their own, they're not aware of delayed reactions to foods. They're not aware of vitamin levels, hormone levels, heavy metal exposure. So it has to be a really big conversation. I know that's not a perfect answer, but it's got to be a big conversation to prove that everything you're taking in is really good, that the inflammatory markers are all down if they were elevated, and you're progressing through and seeing benefit with your tissues and not progressive worsening of your symptoms.
All right, got a good one from Reddit. 29. I feel like I get out of breath more easily than I used to, even though I exercise regularly. My endurance seems lower than it should be. Am I out of shape? Could it be a lung issue?
So it would be rare for a 29-year-old to have a really significant lung issue unless, of course, A, there were smokers, B, there's significant allergy that hasn't been addressed. More likely than not, if you're doing exercise, and I see this all the time in people that do a little bit of exercise, weight training, cardio, full-blown pro athletes, friends of mine, marathon runners, cyclists, the more activity you do, you're using up more vitamins and minerals. And I've mentioned before on the program that magnesium is important for the smooth muscle around your airways, just as it would be around your blood vessels. If your exercise is depleting magnesium and potassium or calcium, or any nutrient for that matter, and you're not getting those levels back up to great range, you're putting yourself into a deficiency, and you may have symptoms like shortness of breath or brain fog or irritability. You just can't get up and go, and your muscles don't feel good when you exercise. So that could easily be a mineral deficiency or vitamin deficiency. In people that are older, typically it may be hormone decline. And adding to that comment, I've had patients that are 18, 19 years old that have low thyroid. And we've corrected the thyroid, and all of a sudden everything starts to come back to normal. Nothing says that you can't have changes in hormones in your late teens. We've seen it. A case in point, a lovely patient that I saw in the Plainview office years back, a 19-year-old girl, was significantly overweight, tall girl, 5'11", but overweight. Her skin had issues. She had pimples and stuff, and issues with her, cramping and pain and menstrual flow, all sorts of things going on, stomach problems. Tested her, took away food allergens, corrected vitamins, minerals, and corrected her thyroid because her thyroid was low. The T3 was low. Gave her some of that. All of a sudden, she started feeling better, did more exercise, stayed on the low-carb diet. And I was following her up every week or so initially because I wanted to see these things create the benefit. In doing so, she started losing the weight, had more energy, felt better, sleeping better, skin was clearing up. Over the course of 3 months, she was just on her way to being a different person. And she ended up, I think she was maybe 210, 220. She ended up bringing her weight all the way down to a perfect range. She was healthy, fit, a completely different affect, happy all the time, sleeping well. So much so that she went out to California. She became an exercise physiologist. She was training people in the gym. She was teaching people diet and nutrients. She just took everything that worked for her and she brought it out there to do for a whole bunch of other people. And the last time I heard from her, she had a very, very busy practice, being a nutritionist and an exercise specialist. So she took the ball and ran with it, so much so that she created a whole lifestyle out of it. It was the most exciting thing to see because when I first saw her, she wasn't happy. And she wasn't really going there. She wasn't going places. And then all of a sudden, everything clicked. and she's, got a wonderful life. Kids and all. So you have to look for these things. If you don't look, you never find. So that's why we test the way that we do.
That is wild. Never heard that one. But
great story. Things pop in my head depending upon questions that people ask. So I've got a lot of stuff in my head over 39 years. Maybe too much stuff.
Okay, we got one from Instagram. Are there any common health trends people should be cautious about? I guess they're talking about keto.
Here's a good one.
And things like that.
A year or so ago, I started seeing a lot of people coming in with, high liver enzymes, all sorts of weird things happening. And I couldn't figure out why their liver enzymes were elevated. And blood work wasn't horrible, no viral issues. So I'm thinking, what are they doing that's, irritating their liver? What are you eating? Breakfast, lunch, dinner, snacks? Nothing really showed up there. And some of them had fatty liver because we did sonograms. I'm saying to myself, there's got to be something that's doing this. And it was bugging me for a little while. Then I heard something on TV and someone else talking about adding butter to your coffee in the morning. And I said, no, why would anybody do that? That's insane. You're heating up butter, drinking it with hot coffee, putting hot fat into your stomach, which gets into your liver. So with every one of the people that I had seen, it was dozens and dozens of them at a time. And still, now when you see that, and when I see some of the liver enzyme elevation, I'm like, why do you put butter in your coffee? They're like, how do you know? I said, because I've seen so many people that have, liver enzyme elevations because they're putting hot fat into their stomach and that hot fat's getting into their, irritating their liver. So that's a fad I don't like. And there are probably dozens of them. I like to create questions in people's minds. I like to make them think and look and read and learn and write down questions and ask me. And, I want to have this dialogue with them to go back and forth. And rather than get online and get information that may be completely insane, I'd rather have them, we have a dialogue for it. Some people fast for a very long time and they don't take vitamins, and then their vitamin levels drop, their immune system gets weak, they get sick. I don't mind if people fast. And like I said yesterday, it's not a bad idea to change around the type of diet you're doing. A low-carb diet, eating small meals throughout the course of the day. Maybe a day of a half a day fast or fasting from night until around lunchtime or early afternoon. Make sure you're still taking your vitamins. You can do these things if it's supervised. I just wouldn't do them on your own because in so many cases you're creating a problem. And there are a lot of people out there giving medical advice that are not experienced enough to give that advice. If you think of alkaline water or alkaline diets, people say, I'm doing an alkaline diet, I'm alkaline all day. I'm like, no, you're not. You can't be. What do you mean? I read the book. I saw the thing. I bought the water device. Only a doctor would know that your pH in your blood has to be a certain point. It can't go up too high, can't go up a point or down a point. It's got to be at 7.2. So if you take in alkaline water, alkaline food, what are you doing? You're holding acid back from being pushed out of your body through your kidneys into your urine. So whatever alkaline you take in, you're holding on to acid. It's completely neutralized in milliseconds. People that eat acid-related foods are going to pee out the acid. So your pH is going to be stable. So you can't become alkaline for an hour a day. It's just not possible. There are people, however, that have really bad lung or kidney or diabetic disorders where they have diabetic acidosis, ketoacidosis, respiratory alkalosis or acidosis. That's a whole rare section of disorder where everything's really screwed up in that mechanism of balancing that pH. So that's another thing that just doesn't make sense. But people wouldn't know that unless you understood the kidney physiology and anatomy and your lung physiology and anatomy. So, sorry.
A lot of people. Hope my brother was listening to that one. All right, what do we got? Can you treat a disease called progressive supranuclear palsy? It's from Reddit.
We've seen some patients with that, the progressive supranuclear palsy. Some people that have this degeneration, not so different from things like the neurologic disorders like MS or Parkinson's, etc. I think some people may be stabilized with stem cell therapy, although I can't say you're going to reverse or change that mechanism so that there's nothing occurring. It's one of those disorders like ALS where, medicine in all of its wonderment and research doesn't have a true handle on it, and I'm not sure why it occurs.
We have another one wondering why she wakes up with a puffy face in the morning. Any ideas?
Well, there's a lot of talk lately about the pillows and mattress, and we tell people to get these excellent mattress covers, Ziploc covers, and pillowcase covers because dust mites are all over the place in your pillows and your mattress, and dust mites live off your skin. And if you were to see a picture of a dust mite, you'd freak out because they're freaky-looking things like from an alien movie. They just have, I don't know what you would call them, little pointy things sticking out all over
fuzzies.
them. Yeah, they're fuzzies. They're horrible looking. And, they live off your skin cells, and they live in your mattress and your pillowcases. You could, of course, wash with hot water your pillowcases and your bed sheets. But I think if you use some of them that are hypoallergenic, if you use some of them that are, barriers to that, you'll decrease your exposure. And we've seen this a lot in patients because someone who may have food allergy or environmental or inhalant allergy, as we pick this up through testing or through their history, some of the swelling of the face or the eyes is because your face is touching this stuff all night long. And the little critters are chewing on your face. Not 100%. I don't want to make too much of a visual there. But yeah, dust mites are everywhere. I thought I'd be a little tabloid for the moment. They're chewing on you. So, yeah, look up dust mites on the computer and look at them. And you'll see what they do. And yeah, a lot of people are allergic to dust mites. And the things that come out of dust mites, I'll let you imagine that scenario. But yeah, look it up. Look it up.
Thanks for the nightmare fuel
Nightmare time, yeah. Like Freddy Krueger. Freddy Krueger looks good compared to dust mites. I'm serious.
I'm looking at one now.
You got to have a picture of dust mites? Can you pull it up?
I'll get it up in a second.
I had a poster in the office, in my East Meadow office, because I used to put posters up of different things. Now I just have all nice illustrated artwork. Alphonse Mucha, who's a spectacular artist with beautiful outlines and pictures and et cetera. But in the allergy department, I had a big poster of dust mites, and people would freak out. Why are you showing me that? You're scaring me. I'm like, okay, must hide the picture. Oh, yeah, there you are. Routine run-of-the-mill dust mite.
Cuddling every night.
Now, I don't know what purpose that exists for. Why do we have those? In this world, why do we have these things? You think, dogs and cats, yeah, of course, they're important. They're companions. Oh, can you have millions of dust mites on your body? I imagine so.
I guess, it's either all living organisms or none. So
why? What's the point of a dust mite? What's the point of a horseshoe crab? There are certain things that keep me up at night.
Wow, horseshoe crab. That's a good point.
Yeah, it's a freaky-looking prehistoric creature. Not too far from the dust mites. So, yeah, those are the dust mites. And there are some that are probably worse looking. So, yeah, you want to totally clean your environment. Shampoo rugs, throw rugs. Don't have wall-to-wall carpet because then your entire lifetime, walking in and out and allowing stuff to come in will get stuck in those carpets. So clean up as much as you can. You can steam clean, fabric on couches. There's a lot you can do. But you want to do that for sure.
Yeah, because what do you, pillows are expensive. You don't want to just throw them out. But do they get ruined when you wash them?
There are combinations of different components in different pillows. So some you can wash. And I think if you put the pillow in the Ziploc, it's like a big, sturdy, whitish Ziploc that lets nothing in and out. It's a barrier. So, you could vacuum it. I'm sure you could steam clean the pillow itself. Some I'm sure you could wash. But if you put them in the Ziploc, then that's enclosing them and nothing can get out.
I'm going to be burning all
now
my
you're going to have
sheets and
thousands of
pillows.
people just running to the bathroom, running to the shower, and scrubbing their face off and their whole body. I don't want you to go crazy.
Oh, yeah, the Rumble chat's a little grossed out.
Yeah, it would stand to reason that there would be. But this is where you hear the truth. I'm not going to lie to you and say there are no creatures like this crawling all over your body.
Fair. Okay, wait, we got another one from YouTube. How does gut health influence overall wellness, and what can we do to improve it?
Good question. Big question. Many answers, many combined effects. What I typically tell people, and this is not the most scientific comment, the gut is the doorway to your body. Right? When you put things into your mouth, chew it, break down, hopefully getting good nutrients, vitamins, minerals, all the good things from foods, they get into your gut. You're absorbing it into your blood. It should go everywhere. If you're doing a good amount of exercise, you're delivering all the good things. So that's the doorway to your body. If you're bringing in foods that have chemicals or junk, fast foods, then you're going to irritate the lining of your gut. You may not feel like you have this horrible burning pain like a full-blown ulcer, but you're not going to absorb well. And you're not going to digest the good things well. So maybe those good things won't get in to your bloodstream from your stomach with bad stuff there. For those people who have allergies, allergy can inflame the gut, and that also can prevent absorption digestion. As people get older, they don't make as many digestive enzymes like hydrochloric acid, so you're not breaking down the food, so it's stuck as a bigger size, and that can't get through the pores in the villi, the finger-like projections on the lining of your stomach, which, of course, as you might expect, increases surface area because you have all these different folds in your stomach. So your gut is really, really important to every part of your body, your bones, your organs, everywhere, what goes into your bloodstream. So in a simple way, if we could find out through the blood test what you need and you're not getting it in, and if we change your diet and get rid of the bad and amplify the good, and yeah, for some people, we raise up their vitamin levels. Other people will have them do vegetable juicing, only organic food. You're going to get greater nutrient density. For a lot of my patients, I tell them, because everybody's busy in the morning, you got to run to work, do whatever you got to do, get a really good plant-based organic protein powder and have that either within a liquid or put it in your coffee, whatever you like. And that gets absorbed right into your system. It's pure protein, 21 grams. I like Orgain. I get that at Whole Foods. And what's better than getting 21 grams of protein and vitamins into your body first thing in the morning? So there are ways to maximize your nutrient density by adjusting your diet. Fast food's bad. Too much of one food and not a good complement of others, not necessarily good. You want to have a lot of fiber in your diet so things can move through nicely and quickly. You want to drink a good amount of water, probably 8 glasses or so of water a day. Some people drink more. But there are ways to really fine-tune that so that your gut will work better. And granted, there are some people that will have bacteria infections of the gut, viral infections of the gut. Some people have Crohn's and colitis, which are really the full-blown worst symptoms that you could have gut-wise, and they don't absorb terribly well at all. Sometimes we have to do vitamin IVs on them because we have to get the vitamins in through the vein, the bloodstream, and bypass the gut for a little bit. For some, we'll use glutamine, a variety of nutrients to help to stabilize the gut. So there's a lot that can go on. So we always look at gut function, always.
All right, back to TikTok. What is the biggest misconception people have about stem cell therapy?
Excellent question. So when people come in, they ask about stem cells. They usually say, I know that's illegal because of what George Bush said. I don't know how many times I've heard that. I'm sure thousands and thousands of times. Does it bother me anymore? Not so much. Did it used to? Yes. So people remember that George Bush, appropriately so, maintained an existing ban on fetal stem cell tissue. The idea was that we didn't want to create an industry of fetal aborted tissue use. Now, other countries, they do what they want and probably still exist somewhere. But stem cells are not illegal at all. Only aborted fetal cells have been banned. When you talk about using your own cells, they're your cells. The likelihood that your cells will do their job and they only have one job to create repair and to shut down inflammatory cascade, the likelihood is extremely high because that's what they do. You don't want to go somewhere south of the border to have umbilical or amniotic stem cells done because they're foreign to your body. You could and would reject it. You don't know the genetics.
But doctor, they said they give it free with my lip injections.
Yeah, I guess you can get that. I mean, I wouldn't dare have anybody touch me who's in some country that's got no standards. You know, you've got your best plastic surgeons and your best doctors in the world in this country. Why go somewhere, pay a little bit less, and then have to worry about a bad outcome? And everybody's seen that show Botched, where the two really brilliant plastic surgeons in California, you know, as tabloid-ish as that show may be, they have to repair bad things that are done in those other countries. There's no standard there. So you don't know if you're going there, what you're getting, what the infectious history, the genetic history of the donor is, how many cells you're getting, how many die when it's frozen, who's taking care of those cells. So that, you know, umbilical and amniotic, I think, is something to completely stay away from. But your own cells, out within a couple of minutes, spun and back into your body, is by far the greatest source. So it should be available for a variety of different degenerative and inflammatory conditions. And I've been doing this for a very long time. We have thousands of patients we've done it with great results. So it's a misconception that stem cells are illegal. They're not. They just banned aborted fetal. Your own cells are absolutely perfect and fine. But good question.
A very interesting answer.
You know, there's a little add-on to that. The other questions people will ask will be, well, I'm 60, 70, 80. Are my stem cells old? And I tell them, no, all your cells keep dividing all the time. Like your red blood cells, they live 3 months. They keep dividing. Your body will break down and use some of these components, reuse them. Your stem cells, if we extract them from your bone marrow, that amount of fluid we take, about 60 cc's, is back to normal within a week to 2 weeks. So those counts are made so fast that they're back to normal. And I'm not sure people think that, you know, the day they were born, your stem cells are made and then they just live as old stem cells your whole life. It's not true. They're made all the time. They divide all the time. And evidenced by the fact that we've treated a lot of people in their 60s, 70s, 80s, 90s. We even had a 100-year-old lady that we helped out with her vision. Stem cells work well into your older years. So it's not as though if you're older, there's any risk with your own cells. They're your cells. Taking them out, spinning, and putting them right back in. The other question people ask is that, why don't stem cells do this on their own? I say, well, stem cells are meant to go out in small numbers, maybe the thousands. And when you cut yourself, it'll help to heal your platelets. The things that are good in your blood will help to do some of that. But they're not going in massive amounts. And they can't get from your blood or your bone marrow inside your knee. So we're just taking them from where they exist in massive numbers and putting them into the joint, putting them intravenously, intravenous and nebulizer, topically for your lungs, intravenous and nasal for the brain and eyes. We're just putting them so they can go do that job. And I'm certainly not the first person to talk about or call it a stem cell or do stem cell therapy. As I've mentioned, 160 years ago, Dr. Haeckel was the first one to call it a stem cell, and then doctors subsequently, I keep forgetting the doctor's name, afterwards was also calling it and doing research on stem cells. And I have to give him credit because he did a lot of work on it, well beyond what Haeckel did. The gentleman's name was, be here in a second, Theodore Boveri, B-O-V-E-R-I. So I don't know if he was Italian. I think he was Italian. Probably Italian.
Sounds Italian.
Italians do great things. So thank God for those people who created the initial awareness, and then worldwide it's exploded over all those years. So, and as I said the other day, I read an article about Australia. The Murdoch Institute, which I imagine was created by Rupert Murdoch and his family, is doing stem cell therapy on children for heart disease and heart failure. So every other country in the world is doing this. This should be available to everybody anytime for all of these issues.
Huge. Okay, we got an interesting one on Reddit. Someone, our viewer, her grandmother back in the day told her that if she ever got a cut, let the dog lick the cut because it'll heal quicker, and she wants to know if that is a falsity that she's been doing for her whole life.
Absolutely not. Oh, boy. Yeah, not a good idea, Grandma. Yeah, because the germs in a dog's mouth can be a big issue or problem. Now, let's think about this rationally. Lots of people have dogs, right? What do dogs like to do when they're just hanging around doing nothing? They like to lick things.
Everything.
Do they lick themselves? Are they licking an area of their body that you wouldn't want to have go near your body, and certainly a wound on your finger? I've seen, things on Instagram and Facebook and some of the stuff where, people are like kissing their dog in a way beyond the way it should be. That's not a good idea. There are germs everywhere, especially in the mouths of animals and on the end of intestinal passageways in animals. So, no, never. I don't care how clean your dog is. I don't care if they bathe 3 times a day. No. Good question, though.
Oh, that was good. They're probably looking like, oh, no. All right.
Bad grandma.
Bad grandma. Have you treated cholinergic pruritus? I'm botching that for sure.
Cholinergic pruritus is itchiness because their cholinergic system is a little bit haywire. And sometimes that correlates with allergy. So I'd have to know more about the person to see, what the triggers are. In many cases, the itchiness and something's triggering it. I also think there may be heavy metals correlated with that. But I don't remember last time I saw somebody with cholinergic pruritus. I'd have to investigate that. Look that up online.
All right. Got another one from Reddit. Hey, Doc, I keep getting eczema flare-ups on my hand. It's just my left hand and wrist, nowhere else on my body, but it is bad. I'm thinking this is a food allergy or an intolerance? ?
Yeah, most of eczema that I see and have seen for all these years, 38 or so years, is correlated with allergies, delayed reaction to something you're eating. A blood test is a good screening test, which might see something. But remember, a blood test is only looking at 3 seconds of blood near the needle that goes into that one tube for allergy. So it can't show you every possible antibody to everything because it's a very small amount of blood. Skin testing, intradermal in the upper arm, is the better test because you're putting a liquid allergen there in the skin with a tiny needle and allowing the antibodies to, 15, 20 minutes, a half hour to get there. That's more accurate. There are some people that have fungal irritation of their skin. And once we look at that, and we can skin test for that as well, we may be able to treat that based upon what we've seen. And I've had patients over many, many years that have psoriasis on their ear or different parts of their body, their knees, the antecubital on their forearm, that have fungal irritation. So it could be allergy or it could be fungal. So that's why we have to look at that, thoroughly.
Okay, got another one from Reddit. Just, a shout out to the Rumble audience. We got 170 live viewers. I just want to let you guys know this is your chance. You could ask any question in the live chat. You can call the studio right
The Rumblers.
There. The Rumblers. You can call the studio, ask any question under the sun that you'd want to ask a doctor in general. He'll answer anything. But we do have a question from Reddit, who's been beating Rumble on questions today. Hey, Doc, I'm 50 years old. and my vision seems fine most of the time. But I've noticed it's harder to focus on things up close, especially in dim lighting. Is that just normal aging, or should I be seeing an eye doctor?
It's always good to see the eye doctor. You know, I know tons of people that their eyes were changing even when they're in their teens. So it's good to see the eye doctor. Make sure they look at the accuracy of your vision with that funny little thing where they flip the little, lenses back and forth, but also have them put the drops in and do a deep look at your eye with the magnifier, look at the blood vessels of your eyes. A good eye exam makes all the sense in the world. Yeah, that's very important.
Okay, and then we had a similar question on, I believe, yesterday's show. But hey, doctor, I'm 42 and I've been getting random muscle twitches in my legs and arms. They don't hurt, but they're happening more often. Could that just be dehydration, or you think it's a neurological issue?
Sometimes it's dehydration. Sometimes it's going to correlate with magnesium, potassium deficiency. So you see this a lot. In some people, it correlates with doing exercise and they're losing water. They're not drinking enough water, or they're, not taking nutrients and they become depleted. So it depends on a few things. How old is the person?
42.
Yeah, in the 40s, things start to change. Your hormones drop. And a few years' worth of vitamin deficiency, which we see all the time, because nobody really knows what vitamins to take, and you can't hit the nail on the head without doing the blood test. So I would look at those things for sure.
All right, and we got a YouTube question. I've been getting random muscle. Oh, that was the last one. Hold on. Okay, I get this odd feeling like my throat has a lump in it, especially when I'm stressed. It doesn't hurt, but it's uncomfortable. Could that be anxiety, or is there a physical reason for that?
Anxiety might create that. Sometimes spasm, in the larynx occurs as a result of anxiety, but allergy is a pretty common reason for that. Think about a person who may have allergies to things they breathe. Those things hit your nose, your sinuses, the back of your throat, sometimes causes a postnasal drip, which causes that swelling sensation. Some people that snore will have that swelling mechanism occur in their throat and may not know it if they don't know they snore. So it can be from a variety of things. Other people can have a thyroid that's starting to increase in size. You may not see it push out forward, but sometimes you can see that push backwards towards the back of the throat. So it could be a variety of things. And yet other individuals, maybe less individuals, will have issues with their neck, and the nerves coming from the nerve roots to your skin, your muscles, and your organs may be affected. So I would look at each of those areas.
And then someone commented, peanuts have copper in them?
So a variety of foods may have a variety of metals and things in them. So we have to be really careful which foods we eat. And I've seen some of this information and I think this occurs across the boards. Food production has been so unsupervised for such a long period of time. There are more heavy metals in foods now than ever before. There's more GMO foods that we're not told are GMO foods. Chemicals like Apeel, A-P-E-E-L, are being put on foods and vegetables and fruits and such. You really have to be very careful what you eat. Now, if we did a blood and a urine test, the urine test might show heavy metal exposure best. So that's actually a good test for anybody to do, because you can see what your body's been exposed to. But I'll be very, very careful as to what you're eating, because the risks are there.
Okay, we got another one from Reddit, TikTok. Hey, doctor, I've been waking up more frequently during the night to use the bathroom. Is that just part of aging? I'm 55, or could it be a sign of something like diabetes or prostate issues?
So the questions would be, if a person's overweight and walking around throughout the day, and it doesn't have to be terribly overweight, gravity will hold fluid down into your legs. And then when you go to lay down at night, that fluid now has more access to your kidneys, and it may make you have to get up to urinate, get the fluid out. Some people that have that issue might have, when they wear their socks, swelling around the top above the sock, because the sock is holding place at your foot and your ankle. So that may be a little bit of excess fluid held by some excess weight. And some people are 5 or 10 pounds overweight, that can happen. Other people can have circulatory issues that may correlate with that. Other people might have swelling of the prostate, benign prostatic hypertrophy. BPH is common. And sometimes that can come from inflammation, from infection, can come from heavy metal exposure. Prostate issues don't have to be absolute prostate cancer, especially at a young age, but you still want to do your PSA and free percent PSA blood test. A sonogram of the prostate is really important. It's more accurate than the digital finger exam and doesn't feel uncomfortable like the digital finger exam. And you can see the measurements, diameter of the prostate. You can see how much or what the prostate looks like with a full bladder, which gives you a clear outline of the bladder. Then you go to the bathroom and you want to make sure there's no urine left over, residual urine, when you recheck the sonogram. So all these things play an important role. Hormone decline can do that. But it's part of what we expect in the aging process. We just want to see if we can help to correct that.
Then we got to follow up on Rumble regarding the peanuts with the copper. They just want to know, is copper good for you?
To small amounts, copper is important for your body, just like a variety of other, micronutrients and minerals. I had something here talking about micronutrients and the importance. I'm not exactly sure where I put it. Selenium and copper are important for your heart contraction, and people that have depletion of those two may have issues with a little bit of heart decline or failure. So yeah, all your minerals are important for your body. It's just that the heavy metals that have no place, in our normal health and structure and function will just cause damage. So a small amount may be okay. Too much copper can cause something called Kaiser-Fleischer rings on your eye. Around the iris, you see a rust-colored ring. That's too much copper on board. But, we do blood and urine for that as well. So I would look to that to give us a better picture as to what your body's doing.
All right. We got another follow-up on Rumble. I take B complex, magnesium, D3, and fish oil 2 times a day because I think they are important. Should I be, or is it a waste of money and not necessary? I'm 55.
You should take vitamins and minerals, but we have to do your blood test. If you're taking 500 units of D, it may not be anywhere near enough. Some people take 1,000, think that's a lot. Still might not be enough. B complex, all of these things, D, etc. You want to check your blood. If your blood shows your levels are great, then you hit the nail on the head. Unfortunately, 99.999% of people, when we check them, they're taking a little bit of this or that, but they're not getting the right nutrient density. And the more people are active mentally and physically, you're using more. So we want to get your blood test, and this is an important comment. We want to get your vitamin blood test to look like it would have when you were in your 30s. So you don't want to have the blood levels, which are expected to be lower as you age. You want to be above that, because as you look at age-related, in maybe a decade, 60 to 70, 70 to 80, 80 to 90, the lab will say what the expected levels are for those ages, which is not good. You want to have those things up at a nice high range, maybe a little bit above the expected range. For example, homocysteine causes plaque in your blood vessels, and B6, B12, and folate help to lower homocysteine. You might be a 70-year-old person with okay levels of B6, B12, and folate, but the homocysteine's high. What do? We check to see if you can convert B12 or not, because maybe you're not converting. And you raise the B6, B12, and folate until you see the homocysteine go down. So it's that specific with vitamin correction. That's really the only way to do it. Good question.
Great question. Shout out Rumble coming in the last quarter. We love it. What else we got?
Awesome. Couple of questions from patients. Connie talks about low back pain after childbirth. Well, what happens, and you could look at a video on this and maybe a diagram on this, is that as the child comes down to that canal, you're stretching the ligaments on the front and the back and all around your pelvis to be able to accommodate for that passage. And those ligaments never really go back to where they were before the pregnancy. So that stretching throughout the entire pregnancy can create problems, can create shifts in the way the sacrum sits with the ilium, sciatica, sacroiliac issues. One of the better things that we've done over the years is either prolotherapy, where we can inject some vitamins and minerals into the area to create some stimulus to try to create repair. And then PRP is great, platelet-rich plasma, where we take your blood, spin it, and inject into those ligaments to create a little stronger healing mechanism. For people who have a really bad problem, then we might opt to do stem cell. Because stem put into that area, those cells will divide, going forward to create repair. And some physical therapy and some stretching and massage. I've never had a patient say they didn't want to go for massage. Can you tell my husband I have to go for massage every week? Yeah, sure. Absolutely. Or the husband will say, can you tell my wife I have to go for massage every week? I say, yeah, of course. I go to a local place, either to get the full massage or to get a chair massage, which I do more frequently. Working out and aches and pains. And, of course, I go to a full contact karate class every Tuesday night. And we have a great school, New Generation Karate. It's on New Hyde Park Road. And it's a terrific class. And we have 20 black belts. And the workout is hard, doing techniques and stuff. And then we fight. It's a fight class. So you get swept out, you get thrown, you get all banged up. It's terrific. May not sound like it, but it's terrific. And the next day, I'm a little achy, a little sore. I'll either go to a great chiropractor, a friend, Bob Hoffman, who's in that class. He's a high-ranking black belt. And he's over on Jericho Turnpike in Huntington, West Hills Chiropractic. Or I'll just go get massages until I can get that muscle spasm just worked out. I tried the teeter table, and I told you, Frankie, about that. I think it's a good thing if you use correctly or put together correctly. Some guys don't like reading directions and just want to build something because they think it's easy enough to do it that way. So I have this in my basement in a gym. I have a full gym set up, big room. I put it together. I get on it. I didn't balance it out the way that it should, and you're supposed to have the leg part further out so it balances your weight. So I went completely vertical, and I couldn't figure out how to get up because I couldn't grab anything to pull myself up. So luckily there was a window sill. I pulled myself up and corrected my position, and then read on the last page of the instructions, there's a tether you have to put on the bottom of the device that goes to the base of the device so that you do not go completely vertical.
Let that be a lesson.
So yes, learning new things every day. Hi. 888-420-9272 if you'd like to call in or give us a text or an email or contact us. We'd love to chat with you.
Rumble rant.
Rumble.
I love the live chat. I didn't get it up for you this time, Doctor, but I apologize. Yeah. Usually he's got it up on his iPad. But shout out Susan K. Spencer. She's been out the whole show. She's been talking. We got Coco Puff. Shout out
Coco
to Coco Puff. But for the rest of the Rumblers, you're very quiet today. I'm waiting for the coffee.
Yeah, they just got to get used to the show.
I love it. I love it. Let me check on Reddit, TikTok, see what we got.
So, friends, if you're watching and you like, obviously, and I don't want to sound cliche, but tell your friends, tell everybody, like and share and do all that good stuff.
Please.
Send it around so people can learn about what we're doing. Website, drcalapai.com. Garden City office, 516-794-0404. And we're going to be speaking with some cool people to interview, of course, over the next couple of weeks and presenting a lot of good information. Thank you for the emails as well to the website. As I say, we're working as fast as we can to get you answers or set you up with even telehealth, consultations. So we're there to help you out. All good, Frankie?
All good.
All good, friends. Thank you so much for listening and watching. We'll be back on Monday at 12:30, Friday 12:30, and next Saturday at 2:30. Thank you. God bless.